Hello everyone. Today, Rashid and I will discuss risk analysis in healthcare organizations. Risk analysis in healthcare organizations deals with where a risk originates from, how often and to what degree the risk endangers patient safety, and how to use the collected data to make a plan to overcome the present and future risk. We begin by looking at risk assessment. Risk assessment has three parts: risk identification, risk analysis, and risk evaluation. The definition of each follows. Risk identification is used to find, recognize, and describe the hazard that could affect the achievement of objectives. Risk analysis is used to understand the nature, sources, and causes of the risk identified and to estimate the level of risk. Risk evaluation is used to compare risk analysis results with risk criteria in order to determine whether or not a specified level of risk is acceptable or tolerable and identifying where additional action is required. Based off the risk that has been found, the goal of risk assessment is to develop a plan for risk management. Taking a look at the risk management process, we have to begin by establishing the context, which in this case is healthcare organizations. After we do that, we can move right into risk assessment, where we will identify the risks, analyze the risks, and then evaluate the risks. After we do that, we can treat the risks. And following that would be control and report, where we can make any changes that we feel are necessary. A major challenge in healthcare organizations is how to determine which risks they should attend to first. Therefore, they use risk matrices, which are a systematic approach that will identify a risk and how serious it is. Based on this information, we can then compare all the existing risks and make a decision on which risk needs to be attended to first. Risk level is dependent on how serious the risk is and the chance of the risk occurring. The goal is to prevent the risk entirely, but if the risk does occur, how can we handle it? A healthcare organization's first step is to choose an approach to estimate risk. We will discuss three options: quantitative analysis, qualitative analysis, and semi-quantitative analysis.
So, among the three analysis options mentioned before, the first one is the quantitative analysis. The quantitative approach calculates numeric values associated to each component that results after risk evaluation. Therefore, risk impact, risk probability, and the risk level are determined in terms of numeric values. A probability and impact matrix is a technique for identifying and prioritizing risk based on their likelihood and potential impact. This can help determine which danger demand immediate action and which can be addressed later. The Monte Carlo simulation is a statistical strategy that uses random sampling, model the outcomes of a given risk. This can be used to calculate the likelihood of a specific risk and its impact on the project. The failure mode effect analysis, or the FEMA. FEMA is a structured approach for identifying and evaluating probable system or the process breakdowns. FEMA can aid in determining the fundamental cause of a risk and developing effective risk management strategies. Moving on to the next slide. As we mentioned before, the quantitative approach calculates numeric values associated to each component that results after risk evaluation. So if you look at the table, you can see how it is calculated. At the bottom of the table, you can see the risk ratings are colored. From 0.01 to 0.03, it's a very low risk. Then on the next one, 0.05 to 0.07, low risk. Then the next one is 0.09 to 0.27, moderate risk. Then it moves on to the high risk, and 0.63 to 0.81 it indicates very high risk. So if you move back up to the table, you can see in the probability like death or permanent disability, it has very high risk when it comes to expected to occur in most circumstances. Moving on to the next slide. The next method is the qualitative analysis. The qualitative method do not express the size of likelihood or the consequences by means of figures. The value of likelihood and the consequences level of a specific event are given by description using a predefined rating scale. Brainstorming sessions are useful for generating ideas and identifying potential dangers. To acquire multiple viewpoints and thoughts, this can be done with a range of stakeholders, including healthcare professionals and patients. Interviews and surveys can be used to collect qualitative data on specific hazards, such as patient safety or data privacy. This can provide valuable insights into stakeholders' attitude and perceptions of a certain risk. Root source analysis, or RCA, is a problem solving technique that identifies the underlying source of a problem. The RCA can help in determining the root causes of a risk and implementing the effective risk mitigation methods. So, if you move on to the next slide, for the qualitative method analysis table, you can see that there is no numbers or range like the quantitative analysis. There is just color coding for risk grading from very low risk, moderate risk, high, and very high risk. And if you move up to the table, you can see on the left side there is likelihood of descriptors, and on the top there is impact and the consequences level. So for example, almost certain, like if you move to the bottom of the table, you can see it says almost certain for likelihood descriptors, it's expected to occur in most circumstances. And to the very right of the table, in the catastrophic column, you can see at the very bottom, the color coding says very high. And if you move up on the column, it lowers down to very high, then one step up, it's high, then moderate and moderate. And as you move to the left side, it lowers down to moderate, and then low. And the final method is the semi-quantitative analysis. Semi-quantitative risk assessment represents an intermediary level between the textual evaluation of qualitative and the numerical evaluation of quantitative risk assessment. By ranking risk according to a predefined scoring system, allowing the information to be processed quantitatively. This approach concerns mapping the perceived risk into categories, establishing a logical and explicit hierarchy between categories and reflecting the order that should be followed in reviewing them. Comparing advantages and disadvantages of the quantitative versus qualitative method, the combination of these two models can be the solution in healthcare system. The semi-quantitative method combines specific advantages of each by decreasing their disadvantages, explaining their diffusion in the healthcare organization as suggested by the government guidelines and best non-governmental practices, although they have a limited ability to correctly reproduce the risk assessment implied by quantitative models. So, if you look at the semi-quantitative risk assessment table, you can see it represents an intermediary level between the textual evaluation of the qualitative and the numerical evaluation of the quantitative risk assessment by ranking risks according to a predefined scoring system. This allows the information to be processed quantitatively.
Let's now look at some challenges that a healthcare organization may face when using the semi-quantitative analysis. The first is representative heuristic. That is, when individuals are more apt to classify an object based on how representative the object is of a certain class or group of objects, with serious implications for probability assessment. Next is availability heuristic. When an individual predicts the chance of a risk based off how easy the event of a risk comes to their mind. Lastly, is anchoring an adjustment heuristic. That is, when an individual does not know all the information, but begins with the current knowledge and makes adjustments until the value is acceptable. This can result in bias and the adjustment being insufficient. An organization must also be aware of their controls and how this can increase challenges they may face. Some controls include policies, procedure and guidelines, staff training, required learning, audits, reviews, physical barriers, checklists, and so many more. A way an organization can overcome their challenges with controls is to develop a control assessment. Within a control assessment, the identified risk and the measure in place to overcome that risk are present. Then, certain questions are then asked to see if a company is comfortable with the measure in place and if it's doing what it's intended to do. Based off these answers, it will give a risk level to see if that a organization should make changes and that the risk is too much right now with the current system.
In risk assessment analysis, the likelihood is an estimate of the possibility that an event or an incident is happening, whether defined, measured, or determined, objectively or subjectively. Therefore, is typically referred to as probability, although these terms are frequently used interchangeably. There are some distinctions to be made. The likelihood of an event or something happening is often represented qualitatively. Probability is a qualitative or quantitative assessment of the likelihood of an event occurring represented as a percentage. Both can be utilized effectively, but the distinction between probability and likelihood is fundamentally important in risk analysis.
Let's now take a look at a visual of likelihood. Within a healthcare organization, it is super important to know when a risk will occur and how frequent the risk will occur. Therefore, within this table, we can see the likelihood description, the probability of it happening, and then the frequency, a time frame to when we should expect that risk to occur. Based off this information, we could develop a plan to be ready for the risk and ways to prevent the risk. We must look to see if we can make a decision based off the challenges that have been presented. The first thing that we start off with is that there is no matrix that can cover all events. Healthcare organizations are facing challenges with biases and whether the matrix is appropriate for their specific situation. A risk matrix needs to be developed for a specific organization and circumstance. Putting the time and effort into the effectiveness of their risk matrices will allow easier and more effective decisions to be made during the risk management process. A poor matrix will be counterproductive and cause error. One way to overcome these challenges is to try to include knowledge into risk formulas. This will improve the data collected and will be more specific to each organization. Decision makers also need to examine the data presented, but not make decisions solely off of it. They need to gather their own knowledge, the data collected, and combine the two to make the best decision that they can.